Well, welcome. Thank you for joining us. I'm Rhonda Henry. I'm one of the therapists with the Health and Wellness Group here on campus. I'm joined today by my three colleagues, Ann Bassoni, Kim Relaford, and Eric Wilkinson. And you're going to hear from Kim and Eric today. Ann's going to be doing the work in the background. So she's the all powerful operator in the background for us and kind of watching the chat and things for us. We're not going to have a lot of time for chat necessarily today, but certainly if any questions or concerns pop up for you, feel free to put those in the chat. We're doing one more session of this next week, and we'll be happy to kind of incorporate that in or give you some direct feedback if that's needed. All right. So today we're going to be covering a couple of specific areas. We're going to be talking about the impact of emotional distress. I think, many of us probably showed up here today because folks are dealing with some unusual stress that's gone on. There's a lot of political and social upheaval going on, a lot of uncertainty and change sort of going on in our world right now. And I know we as therapists have definitely seen that in our own lives living in this world, but also with a lot of the clients that we've spoken with and a whole lot of folks who've had some urgent needs in these last few weeks as they felt a little bit overwhelmed by all that's going on. So we're going to be talking about that and then really want to spend some time talking about how to manage some of those thoughts and feelings and behaviors that might be coming up for us right now. What are some things we can actually do to manage in that feeling of overwhelm? And then Eric's going to wrap us up with some suggestions and resources for ongoing support in case you might need that. So let's jump right on into this. With the social political things going on right now, we may all kind of experience this or call this lots of different things. For some folks, this may feel really, really big. It might feel traumatic, really overwhelming. For other folks, it might be bringing up feelings of worry or uncertainty, maybe some anxiety. It may feel threatening, in kind of a broader way for us. So again, we may be in different points sort of on that continuum of reactions. We might feel different or feel some similarities with other folks. And even from day to day, we might feel like these things or thoughts are feeling much bigger some days and a little more manageable on other days. But however it's kind of showing up for us, we know it's a demanding time. There's a lot of, again, change in the air. And so we know that's going to put us as humans in a space of demand. Sometimes when we are facing a lot of demand, especially when it feels big, there's maybe uncertainty as part of that. It can really hit up against some of these bigger kind of one second, sorry there, these bigger kind of existential fears that just we as humans carry, that we just generally have in us. And we know when something threatens one of these kind of core areas, we're going to have a big response to it. And that might be a lot of emotion, that might be physical responses, that might be kind of ripples and seeing this sort of disrupt other parts of life. And certainly, I think when something, kind of big drops initially, these are some of those kind of common initial reactions. So let's kind of talk through these for a minute. Some folks may have experienced some of these feelings at different points, along the way over the last little bit. We know that there's still probably a lot of change kind of afoot. And so we may experience these, coming up as well. We know that we can have some emotional numbness or that feeling kind of we're in shock a little bit, we're on high alert. We might have kind of emotional upset. So that might show up as feelings of sadness, maybe helplessness, some nervousness. We might see our behavior reactions change a little bit. So we might find ourselves just not feeling like ourselves. Maybe we're feeling more irritable. Maybe we're finding that we're having these angry outbursts. We might be engaging in maybe risky behaviors. Sort of that background thought of, what does it matter? Why do I need to set a limit for myself? Why can't I just sort of do what feels good at this moment? We might be experiencing some social reactions. So we might just socially, our kind of social battery might be feeling really drained. We might be avoiding people or avoiding activities. We might be feeling hypersensitive. And so maybe that's, we're around folks that we're typically really comfortable with, but maybe a comment really gets under our skin or somebody's laughter at something, really rubs us the wrong way. So we're really feeling that emotional sensitivity being heightened. And we can also have some cognitive impacts. So we might have trouble concentrating, remembering, falling asleep. We might find ourselves kind of ruminating on some of the more difficult thoughts, that we're experiencing. All of these are really common initial reactions when there's something that kind of comes our way that is upsetting, in some way. And so noticing for yourself in these areas, maybe what's kind of been more difficult for you to navigate or to manage. When we shift over and Kim talks about some of the ways of navigating some of these feelings, it just may help you hone in a little bit more on what might be a good starting point for you. We also know in times of overwhelm, when we're trying to kind of process that, it can be really difficult. Just the very nature of what we're going through can be hard for us, can make it more difficult for us to actually dig in there and get through sort of that processing in a way that feels effective. So we might notice that both internally and externally. Maybe I'm having a hard time sitting with my thoughts and feelings around some of these things. And maybe I'm really having a hard time expressing that. Even with somebody I'm close to, I can't quite put it into words, or it feels like the words I'm using are big enough, to really describe what's going on. We might find during this kind of time that it's hard to connect to other folks. Again, a little bit like that, some of those points on that last slide, where we're feeling a little more isolated. It's really common to feel isolated when we're in that overwhelmed space. Um, excuse me. We know that even sometimes routine things can feel just kind of intense and overwhelming. Some folks have described to us, it's just hard to sort of get out of bed in the morning, and make myself go into work. It's hard to get up and like feel motivated to, cook myself breakfast or do my meal prep the way I normally would. Like just those routine things that folks know are kind of a good part of their day or their week, either feel like they don't have the same meaning or they're just really difficult to actually do. Sometimes it just feels like it takes too much energy around that sharing and giving context. So again, with that same idea of we might be isolating a little bit, even when there's something that we want to maybe talk about or process externally, we might just have a hard time kind of finding those words or finding the energy to sort of put those thoughts into words. Often we know that it is difficult to avoid these pervasive news and information cycles. We could talk for an hour about the burden that that kind of puts on us and ways that we try to navigate some of those things. Kim's going to speak to some of those in a couple of minutes, but it can be really difficult, I think, to avoid. And what I know I'm hearing a whole lot recently from my clients is this sort of balancing of wanting to stay informed, but also not wanting to get overwhelmed or taking in too much more information quickly puts them in a space of overwhelm. So figuring out where that line is, that sort of healthy for us line. And I would encourage that we think about that every day that might be a little bit different, or this week might look different than next week. Um, let's see, sometimes we don't want to burden others. We maybe know our friend is struggling or our relative is struggling, our partner is struggling, and we're not wanting to sort of add to that burden. Sometimes we do share or we sort of take that risk and we don't get the best response. Somebody kind of shuts us down or they minimize our concerns or they brush us off. Sometimes it may start conflict. There may be some friction with who we're talking to, and it may end up kind of expanding some of our feelings of distress. Sometimes we know we're going to be in that kind of prolonged freeze response. Sometimes that will show up as like lack of motivation, feeling more indecisive, kind of in a fog. We might feel like really all of the change we're experiencing is maybe have deeper impacts on us, really shifting things like our worldview, shifting our perspective, shifting how we see each other and how we connect with each other. We also know that any kind of current traumatic or difficult event or situation has that potential to trigger past what may seem like unrelated kind of older things. So, for example, you might be finding yourself feeling really overwhelmed with all of the news coming in, potential changes on the horizon. And you might find yourself thinking about something that was a couple of years ago. Maybe you went through a hard breakup or divorce, and you find yourself thinking about that or dreaming about that at night. And part of that touches into those old situations and those old traumas because it's similar feelings. It can feel like times where I felt afraid or overwhelmed or out of control or lonely. So sometimes those feelings will really trigger that fallback sort of into some of those older memories of other situations. So even when they feel unrelated, sometimes again, all of that emotional turning up can manifest in that way. So we know that there's some longer term impacts that we can kind of run into if we're both either under prolonged stress or difficulty, or if we're not able to find some effective ways to manage some of that. We know that some of those hard feelings can linger a little bit. We can really settle into feelings of maybe resentment or irritability or anger, things feeling unfair or unjust. A lot of fear-based sort of feelings that we can find ourselves kind of trapped in. We might find ourselves with that longer term kind of shift in outlook. And again, we might find the feelings of overwhelm, hopelessness, helplessness aren't just that immediate sort of feeling when we hear something difficult, but they've lingered a little bit, or they feel like they're really sticking around a lot longer. Sometimes I know I feel like I can often, okay, I have something difficult, I can sort of sit with it for a day or two, and then I can usually process and kind of move through it. You might find that normal rhythm isn't feeling quite the same. Um, it's easy, I think, during a time of so much change going on and in change that we've all got probably very varied and different opinions about. It's easy to feel really uncertain and vulnerable, in this world, just functioning in this world during this time. We know there can also be some fallout in our relationships. We are, as humans, are created to be in relationship with other people. So whether that's at home or at work or out in our community, we might find ourselves just at a baseline feeling less patient, more distracted. Again, struggling with isolation, either wanting to be alone, or for some people, maybe feeling more clingy or connected to other folks. Sometimes we're feeling guilt when we feel absent or distracted. If we're trying to, if we're parenting or we're wanting to be there for our partner or our coworkers, be a good team member, but we find, shoot, my thoughts just keep drifting away. I'm really struggling to stay focused. I'm really, even though my heart might want to be present and be connected, I'm really cognitively just kind of out in another space right now at what I'm thinking about. We might feel those longer term rifts. So, we talked about some of the friction that can come up. I think, many of us are aware of just, again, the changing world we are in has a lot of different viewpoints in it. And so, with people that we care about and love, we may be really experiencing some friction. And for some of those might turn into longer or bigger rifts. And then in terms of functioning impact, certainly some of that focus, concentration, sleep, appetite changes, just how we're getting through our day to day often feels different, and it feels off when we're feeling this overwhelm. We might be seeing some health impacts. And I would, especially in this area, really encourage you to think about your own health markers or issues that you might be dealing with. And if blood pressure is a concern, digestive issues, migraines, these are all areas that we know can really get ramped up when we're feeling that distress in our body. And certainly a wide variety of health conditions can sort of be made worse by stress. That's why we're wanting to come in, or we wanted to come in at least and try to get a handle on, again, what are some things we can do? Where can we take care of ourselves maybe a little bit differently? And then we might see a higher just reliance on unhealthy coping skills. And that's easy to do in a lot of ways. Sometimes we think of those in terms of more of the sort of big end of maybe alcohol, drugs, that sort of end of things. But we also know we can have over reliance that can be problematic with issues around food, shopping, getting lost in our phone, playing online. Anything that we do, we can amplify it, and it can become too much, where we're starting to feel out of balance a little bit. And then we may just have some impact in our work, whether that is changes in workload or approach or scope of work. We know that some of the sort of world changes that are going on may trickle down into really having that day-to-day impact in all those areas of what we're doing. So knowing this impact is here, let's shift toward what do we do with this, okay? So with that, Kim, I'm going to hand that over to you.
You so much, Rhonda. So, as Rhonda said, I'm Kim Relaford, and I'm also one of the therapists here at Health and Wellbeing for Employee Mental Health. So, I wanted to talk about how we manage this impact as Rhonda's kind of laid it out for us. We're going to talk about practicing and prioritizing self-care, communicating and setting boundaries, practicing mindfulness, and focusing on locus of control. So, if you go ahead and go to the next one for me, Rhonda. All right. So, when we think about prioritizing and practicing self-care, it's about not only just thinking about what do I need in this moment, but a maintenance of those things. So, when we maintain or implement daily routines like healthy eating and regular bedtime, exercise, and hobbies, these are things that if we do them consistently, they kind of keep that social battery up a little bit. They keep our bucket filled, however you want to, how do you want to explain that? But these are things that in the long term are going to pay off for us because they're going to help us to maintain. We often also need to reflect on what we need to feel safe and cared for in the moment and take steps to meet your needs. Whether that's needing a time alone with a big blanket wrapped around you, connecting with people who are like-minded, feeling that connection, and really feeling that sense of safety in a world that doesn't feel so safe right now. Those are things that meet your needs. Being aware of those urges to numb or avoid, Rhonda did a really nice job of explaining how those can impact us. And it's sometimes we can avoid them. Sometimes we're going to go to those things, whether it's, that thing of Oreo cookies or, an extra piece of cake or things that are going to like give us that little bit of a quick pleasure principle kind of thing where we feel, oh, it feels good. And I'm feeling a little numbed out from the emotions. And that's it. But how aware are we or how often and how we're using those? And is it getting more frequent? And also being aware of tendencies to self-isolate. It's really easy to kind of pull into ourselves and withdraw when everything feels too big, back to that sense of safety. And really leaning into the idea that sometimes we need professional help. And that means utilizing a therapist or a coach or someone who will be able to talk to you and, like really help you process what you're feeling, the emotions you're experiencing, and talk about some next steps in order to manage that. Okay, Rhonda, next one. Okay, talking about mindfulness. So, practicing mindfulness, I mean, mindfulness has been around for a very long time. It's that intention of life, of being focused on the moment, being present, using things that help us to manage stress. It looks at consumption as well. So, let's look at this idea of utilizing mindfulness techniques to manage stress. So, some ideas around that are things like deep breathing, meditation and yoga, progressive muscle relaxation, and self compassion. We often talk to ourselves so poorly, and that just keeps our anxiety up. It keeps our stress up. It makes us feel bad about ourselves. It adds to the negativity. Negative thinking is really addictive. Like when we start it, it becomes almost habitual and it's hard to pull ourselves out of that. So talking to ourselves like we would our own best friend, thinking about what our own needs are, that's self-compassion. And that is definitely a mindful practice of being present and thinking about my needs in this moment. Then there's also the idea of practicing mindfulness in the way we consume media or how we reduce our exposure to stressors. And so some of the options that we have listed here for you is things like set time limits for news consumption. I know I did this during the pandemic, and it helped me to survive that time frame. But I also think that I've kind of maintained some of that, but have also found that I'm having to up it and reinforce the boundaries around this idea of time limits for news consumption. We are being bombarded constantly with news. Some of it real, some of it exaggerated, some of it not real, and it's really hard to tease those things out, especially like Rhonda said, that 24-hour news cycle where we hear the same thing over and over again. It gets in our psyche. It really brings us down. It makes those fears bigger. And so maybe setting a time and saying, I'm going to spend 20 to 30 minutes a day. I'm going to review, what the big headlines are. I'm going to lean into those things that I really need to find out more about, look for alternate sources if I need to, and then make sure that, that's the time I'm going to do that. The rest of the time, I'm going to focus on things that are within my, that bring me joy or bring me connection to others, and not so much just really get engaged in that all the time. We only have so much uh, bandwidth for things like particularly like uncertainty and things like that, so we need to provide ourselves with a counterbalance of that as well. And then I really like the idea of like, how do you use tools to filter out political content on social media? Again, bombardment. I love TikTok. I love social media, but I have had to be really careful about how much I spend on different videos, because if you watch one video, then you get 20 of them that are like it. And so if I watch a political video, all of a sudden all I'm seeing is all the political videos. And so even thinking about how do I filter that out? How do I manage my own algorithm for that? When I'm starting to see a lot of negativity on my TikTok line, I'm gonna go and I'm gonna look for all my cat videos and all of the things that really bring me joy, like the West Coast swing dancing and some people who are telling jokes and things like that that can like kind of bring me that kind of piece of joy and give me that distraction I need without it feeling more of a bombardment in this time of such uncertainty. Okay, next one. Okay, I really like this idea of locus of control, probably because I am a control freak. But this idea of like we feel like we should be able to control ourselves, others, and not and I don't mean in a negative way, but like control ourselves, our situation, our environment. And honestly, most things are completely outside of our control. And that idea of allowing ourselves to realize that we can only do so much, that we only have control over so much, is actually kind of freeing. So when you think about locus of control, things you can control are basically yourself. Your thoughts, your actions, and your decisions. You can influence other people's actions and choices, and even how maybe a team might respond to a change. But you can only influence those things. You can't control those. And we definitely have many, many things that we cannot control. And in another version of this, you might call that your circle of concern. And that's things like the economy, traffic, the weather, what's being said here, what's being said there. We just have no control over those at all whatsoever. And in those times, that this is the time when we lean into like refocusing on what can I control, what can I do for myself, What do I want to choose in this situation? What do I want to be in this situation? Almost like an internal processing that we can go into ourselves when we feel like the world is too big. Okay, Rhonda. So here are some suggestions about things we can control versus things that are outside my control. So again, other people's opinions, media coverage in public situations, how others care for themselves, legal or administrative outcomes. These are things that are too big. They're outside of our control. We may have had some influence on them on a small scale, but overall we don't have much control over those things. We can control meeting my own self-care needs. And both Ron and I like a book called The More or Less Definitive Guide to Self-Care a whole lot. Like, if you come and see me, I'm going to tell you about that book and really encourage you to get it because I really love it. Because it's not a book that's going to be like, oh, here's self-care and why self-care is important and 20 points about why you should do self-care. It's just like self-care, duh. And then A to Z, all of these ways that you can practice it. But what I really like about that idea is that one size does not fit all and one size does not fit all situations. And so it gives you all of these ideas about how you can practice self-care that you may have not even thought about, or that you may not have might not have thought about how and when you would operationalize those pieces of self-care. And so in the back of this book is actually a matrix that helps you kind of think about what are you feeling, what do you need to do about that right now, and actually helps you narrow down to 3 or 4 things you can do depending on how you respond to the questions in that matrix. So I can meet my own self-care needs. The name of the book is The More or Less Definitive Guide to Self-Care, and I think the author's name is Anna Borges. Is that right, Rhonda? Does that sound right? So, okay.
It does.
So that's,
I was going to say,
yeah, go ahead.
I'll include a link when I send the slides out.
Perfect. Perfect. Thank you, Rhonda. So I also what I can control is how, when, and where I process what happened. I can set limits on my boundaries, and I can set limits and boundaries over things and when I'm going to kind of participate in conversations. It's okay for me to say, to even to my spouse, who tends to be a like-minded person with me, but sometimes I can't do it, and I'm just like, I can't do this anymore. My brain is full. I cannot process this anymore. Let's put a pin in this conversation, whether it's just like what kind of end table we're going to buy, or what's the world going to be like 10 years from now. Sometimes I have to just say enough. And then how I support and show up for others, because at the same time I'm trying to show up and support myself, I want to support others as well. So when do I have extra to give? When can I allow for more time on things that are important to us? Because my spouse, my friends, my family, they deserve my support as well. Okay, Rhonda, next slide. All right. So thinking about managing impact, still on this idea of locus of control, shift the focus from reaction to external events to personal actions. Again, what do I choose in this situation? Who do I want to be in this situation? And what can I do? What can I control in this situation? And so things like getting involved in community service, really leaning into those things that are the most important to you, because a lot of the things that are uncertain right now are important to all of us. They undermine our own sense of beliefs, fairness, practices, whatever you want to call them. But we cannot engage in all of those things at the same time. We just don't have the emotional capacity for it. And so pick those things that are most important to you. Get involved in community service around that. Support those causes that align with your personal values and engage in constructive activism. And then also connecting with like-minded individuals for support. We need those moments of connection and that sense of safety that comes with being around folks we can kind of really let our hair down and talk about things and feel safe about. So joining those local groups, participating in forums or discussion groups, or even using online platforms to engage with others, like private Facebook groups or other types of social media, YouTube channels and discussions. There are ways that you can engage with others in those online platforms that allows you those moments of connection. Okay, Rhonda, I know we're running out of time, so next one. So, about communicating and setting boundaries. None of these are probably novel ideas, but they're important to speak them out loud to ourselves sometimes. Encourage healthy dialogue, using those really good communication tools, like using I statements to express feelings. Don't, whenever we say you, people always get their defenses up. It's like it literally can almost see a force field come up when you start a sentence with you. So, saying I and how I experience that and how I express my feelings, actively listening to others' perspectives without judgment, just hearing them before determining how you're going to judge that or how you feel about something. Focus on shared values rather than differences. And there are shared values. Sometimes we got to dig for them. And some people are not going to share values with us. And maybe they're just not people who are allowed in our life right now. And that's okay too. Plan for questions about your work in high profile situations. Let others know your limits. Limit work and stress focused talk at work and home. I gave an example of that recently, just a minute ago. Maintain those social connections. And remember, you can't be responsible for everyone's well being. We have to put that mask on first, and all of those other wonderful metaphors we use for why we have to put ourselves first in order to be there for others. They're true. That's why there's so many of them. So just remembering that. Okay, Rhonda. I'm going to turn this over to Eric now, and he's going to bring us home. Thank you all.
Thank you, Kim. So I'd just like to note that when there is a lot of social upheaval, political change, it can feel like at times we're being bombarded with bad news or threatening news. It could feel like there's threats to our work, our livelihood, even threats to our identity. One of the things that when we're experiencing a lot of news or there's a lot of social events that feel threatening, it really creates a strong stress response within our body. Just want to note two things about stress. One is that when health researchers have looked at stress, we know that elevated stress has negative health outcomes. But we know what's even more a predictor is the way people view stress. When folks see stress as something that they can handle, it doesn't usually have a lot of negative health impacts. When stress feels like it's something that's overwhelming or too much, that's when we start to see the bad health outcomes. So when we think about what happens when we experience stress, one of the things that happens is the body actually releases oxytocin, which gets a lot of media attention as the love hormone because it's the chemical that's released when we are falling in love or when we're experiencing physical affection or we see a cute baby or a cute puppy. So it's a bonding hormone, but it's also a stress hormone. When we are under stress, our brain actually releases more oxytocin because it's trying to prompt us to seek out help or seek out connection with others. So how do we know when we need some professional help? It would be if you're feeling a lot of distress, you could have physical symptoms, you could have a lot of anxiety or worry. You may no longer enjoy things you previously enjoyed. If this is happening more than a few days, certainly if it's more than a couple weeks, it probably makes sense to seek out some professional help. Also, if it's intense to such an extent that it's interfering with daily activities, maybe you're not spending time with friends or family, maybe you're calling in sick to work, it's really intense, that's also a sign you should seek out some professional help. If you notice that everywhere you go, you feel like you're being triggered or you're being activated, it's this feeling of like, I just can't get away from this. Maybe hearing other people's conversations, seeing things on the news. If you're feeling triggered very often, again, that's probably a sign to seek some professional help. And if there's a qualitative decline in your life, meaning that, you know, you've seen a shift where life suddenly you start to question, like, what am I doing with my life? I feel like I'm unhappy all the time or I'm stressed out all the time. If you notice a decline in your quality of life, again, that's a good time to reach out for a professional. Okay, the next slide. So here is kind of a range of options available to you. Within health and wellness, I'm one of the four therapists. The other speakers are therapists, and Ann Bassoni's with us. We're all available to meet with you. If you meet with us, you get 5 free counseling sessions every year. These are also available to your partners and your dependents and to your spouses. Our sessions are not part of your medical record and they're private and confidential. So We encourage you, if you're feeling overwhelmed or you're noticing, an increase in emotional, physical health problems that seem to be related to current events, certainly reach out to us. You also have UK outpatient psychiatry. They will bill your insurance. There could be a copay. There's the IRAF clinic, and they specialize in individual, family, and couples therapy. There is a small fee that I think is based on what your copay would normally be. There's family and community medicine. They have counselors on staff. You do have to be a patient in that clinic. There's the Team Blue Clinic, has a psychiatric nurse. We're able to refer folks there if you're meeting with us already. Of course, there's private therapists out there who either you have to have them bill your insurance or you have to do self-pay. And then UK also offers Live Health, which is actually a free telehealth service. And so you have a wide range of options. And I encourage you, if you feel like you might need some professional help, to look into these options. If you're having thoughts of suicide or self-harm, or you're feeling like you're really in crisis, just to remind everybody, 988 is a number that you can call or text any time of day and speak with a trained mental health professional. And if there's ever immediate risk, of course, go to your closest emergency. Next slide. Over on the left, we see a QR code that will bring you to a page that provides profiles of therapists within health and wellness, and also information on how you can schedule to meet with us. We see people both in person and through telehealth. Health and Wellness also has two health coaches. And so over on the right, there are some links if you wanted to meet with some health coaches to talk about stress management techniques, or just learn some skill building. Maybe you don't need to do a lot of emotional processing. Health coaching is also a good way to go. And so with that, that concludes our presentation. Rhonda will be sharing these slides with you. We appreciate you all coming and visiting and spending some time with us. If you have any additional or follow-up questions, you can certainly email any of us. Again, I'm Eric Wilkinson. Rhonda Henry spoke, so did Kim Relaford, and Ann Bassoni is holding down our production today. Feel free to reach out to any of us if you have any follow-up questions or concerns, or want information about any things